February is American Heart Month, and one thing we should all learn a little bit more about is heart disease. Are you at risk? Do you know when you should see a cardiologist? Well, we went straight to Dr. Adam Raskin at Mercy Health for the answers to get a better understanding of heart disease.
My name is Adam Raskin. I'm an interventional cardiologist here at the Mercy Heart Institute. I'm the medical director of Advanced Cardiovascular Support Services and the medical director of the cardiac ICU here at Mercy West. There are several symptoms that are concerning when someone has the risk for heart disease. Some of those are as simple as shortness of breath. The term I use a lot is exercise intolerance, so the inability to do your basic day-to-day things. If you're having a hard time doing what you consider to be normal, that is sometimes an early sign or suggestion of heart disease. I describe the heart as a house: 4 rooms, 4 doors, electricity, and plumbing. The most common form of heart disease is a pipe issue, and the pipes get clogged up, just like they would in a house. If you have a sink, what are the things that commonly clog up a sink? The stuff that you put down the sink, right? So cheese, syrup. Syrup is similar to diabetes, cheese just like cholesterol. People who are at greater risk are the people with those types of diseases. If you're diabetic, if you have high cholesterol, if you're a smoker, those are the things that clog up a pipe in a house. Same exact thing with the heart. If you have those pre-existing conditions or those diseases, that put you at higher risk and usually warrants an evaluation. The greatest way to reduce your risk of having heart disease is treating the things that cause it, making sure your cholesterol is well controlled, your sugar is well controlled, your blood pressure is well controlled, staying as active as possible. Those things that you do on a day-to-day basis are their greatest benefit to you, and either treating heart disease if you already have it or preventing it from getting worse. I get asked the question a lot: when do I need to see a cardiologist? I think the first thing I would always start with is just having a conversation with your primary medical doctor. They are a phenomenal source to determine whether or not your symptoms are suggestive of heart disease and whether or not you should be checked out. People at higher risk are people with high cholesterol and diabetes and smoke. Also, if you have a family history of heart disease. Those criteria usually would warrant an evaluation maybe earlier in life, but anyone who's typically over the age of 55, who's got several risk factors, I would definitely have the conversation with your internist and see if you'd qualify for an evaluation with a specialist. The Mercy Heart Institute is a phenomenal institution because its availability, our locations throughout the city, and a lot of the providers do a comprehensive evaluation. If you come to my office, we do an evaluation from the neck down, and what I mean by that is the body is a system of pipes. I use the example a lot that I'm a plumber, so I check pipes everywhere. If you have a blockage in your neck, a blockage to your heart, a blockage to your legs, those are the type of evaluations that you get when you come to the Mercy Heart Institute. So it really makes it a nice comprehensive evaluation and convenience for patients to be evaluated. One of the tremendous joys of being a cardiologist is our ability to not only treat and fix disease, but it's to be with people when they're the most vulnerable. It is very scary. It's a scary time for patients. It's a scary time for families. We create a relationship with this once you've been in our care, and then that relationship is lifelong, hopefully. And that is one of our biggest joys, is being with someone, telling someone that they're going to be okay, that their symptoms, we can do something for them and make them feel better, live longer, and then the quality of life. I say this commonly, that I don't do what I do for people to sit around. I do what I do so people can do whatever they want, that they should not be limited. If they want to go hike a mountain, I want to get them to where they can hike a mountain and spend a lot of good time with their family, but quality time with our family. And that is really the joy of what we do at the Mercy Heart Institute.